Welcome. I'm glad you could join us here today. Allow me to mention a few things about this presentation. This is an evergreen webinar. If you're not familiar with that term, evergreen in this sense simply means you can view this webinar at your leisure. You are watching a recording, but unlike a recording, you can still communicate with us by asking questions through the chat box. These will be forwarded to us offline, where we will review and respond to you. We chose this format in order to deliver this overview as efficiently as possible. You will also be able to view the frequently asked questions by selecting the link at the bottom of this viewing page. If the answer to your question is not there, we will return a response within 48 hours or less. So again, feel free to use the chat area to submit questions. My name is Gary Eberlin of Enroll 123. We are an expansion partner of DiRx Health. DiRx Health is a digital pharmacy that's changing the way medications are being acquired and delivered. Of course, it's only my opinion, but this is how I think prescription medications should have been filled all along. Now, let's talk about what DiRx Health is not. DiRx Health is not a discount program. You won't print out a coupon on the latest deal for any of the medications you need. You won't have to drive to a special pharmacy to get that one unique deal. You won't pay high retail prices for generic medications like you do at those big retail corner pharmacies. You know which pharmacies we're referring to. Have you ever wondered how they can afford to build so many of those locations? They're virtually on every major intersection. Well, these retail pharmacies have established relationships with all the major drug manufacturers, but they use that relationship to maximize additional revenue for them. Many generic medications are marked up to over 1,000%, according to the Wall Street Journal. From a profit standpoint, pharmacies make more on generic medications compared to name brand drugs, according to the Washington State Office of the Insurance Commissioner. So let's expound on the current state of healthcare in the U.S. Unless you are a veteran of the healthcare world, much of what I'm about to say may surprise you. What won't surprise you is the lack of transparency. While this is a product most of us need, prescription medication, and use every day, it's the inner workings of that chain, that path from the drug manufacturer to your local retail pharmacy that grabs more dollars than make medications painfully expensive to you and to your employees. This lack of transparency hides the windfall for those involved. This sea of middlemen can be from 4 up to 10 entities, and again, each pretends to provide service that adds to the cost when they touch it. What value are they bringing that merits their 20% piece of the pie? Each layer adds cost. Now it's time for us to adjust our thinking. The patient needs to be first, and we need to stop rewarding the middlemen. The team that has brought DiRx to us today have come from many of the same entities that are part of the traditional drug delivery system. They know the impact the heavy supply chain has on the patients and cost of their prescriptions. Collectively, they are turning the drug delivery system on its ear. You'll recognize some of the companies these members have worked for in the past. McKesson is one of the 3 largest drug wholesalers in the U.S. Many of you recognize United Healthcare as one of the largest health insurance marketers. Optum is the third largest pharmacy benefits manager in the U.S. as well. Then there's Merck, one of the largest drug manufacturers in the world. This leadership team has a veteran view of how the old guard medication delivery chain has worked and perfectly situated to drive DiRx. The DiRx strategy is to bypass the middlemen and pass the savings on to the patients. Drug wholesalers, gone. Traditional PBMs, gone. Rebates, gone. Health plan markups, gone. Traditional pharmacy, gone. You can quickly see how the DiRx model slashes cost from the traditional model, and the patient wins with lower drug prices. Regardless of coverage, what's amazing is everyone can save with DiRx. Health insurance coverage is not necessary with the generic medications through DiRx. Their cash-based system with an auto refill program also includes free home delivery. The affordability of DiRx generic medications make it possible to use those dollar savings elsewhere in the household, like for that $4 gasoline, right? With over 1,400 generic medications accessible through DiRx, you'll have the top 75% of the most consumed generics available to you. Now, considering COVID-19 will be around for the foreseeable future, eliminating human contact may well ensure better health by not physically visiting the pharmacy. Considerations for DiRx really just comes down to the bottom line: cost. As you take a look at this slide, you may notice some medication that is on your personal medication list. It's pretty common to see a $10 price point on the most filled generic prescriptions. In fact, many of you may be acquainted with a big retailer that has a noted $4 and $10 generic program. That program has 63 generic medications on its plan. While they call it a 4 and 10 plan, a large chunk of those prescriptions actually cost more than $10. Yes, I was a little confused by that as well. Their incentive is to offer you a 4 and 10 program to get you in the door to browse and to buy their household or grocery items. Your savings experience may vary, but most people will save 40 to 55% versus medications purchased strictly under a health insurance plan. I think health insurance plans will be changing the way they address pharmacy benefits with DiRx in town. Let's take a look at a real-time comparison. This is from August the 2nd of this year. And it involves prominent name brands. And in particular, this is GoodRx and their offerings. These drugs listed tend to be the most popular on the expensive side of generic medications. As I mentioned in my opening statement for this webinar, unlike GoodRx, there are no hoops to jump through to get your DiRx medication. No coupons to print, no travel to this pharmacy or to that pharmacy. Just plain old math shows you that there is little that actually compares to DiRx. Take a moment and review some of these common drug comparisons. The average household struggles with paying for expensive prescriptions. Some experience savings as demonstrated by this review that provided an annual savings of over $1,200 a year. Now, this person has a full coverage health plan. On a personal note, when I started service with DiRx, I had 3 maintenance medications. I compared them to my current prescription spend through my health insurance plan. After my comparison, I learned I would save 48% over using my health insurance plan. Think about that. Here we share another example of a prescription made available through a health plan managed by a PBM. The cost there would be $577. This person looked at the same prescription on the GoodRx site, and it could be obtained for $193. Now, this slide offers two insights taking place here. First, the DiRx prescription cost was much less than both the PBM or GoodRx program. Second, just take a look at the script markup of the PBM on this medication. Their perceived functionality is to locate and obtain medications at a lower cost and pass that on to your health plan. But instead, they act as a concierge service, charging rates much, much higher than a drug discount program like GoodRx would. They have become another layer of middleman cost to a prescription. Now, the truth about prescription affordability in the U.S. is noted here. We tend to believe as Americans we are well covered when it comes to prescription needs. The facts indicate that 13% of the U.S. citizenry are uninsured. Another 28% is underinsured, and 59% are deemed to be insured. Stated another way, 40% of Americans are not adequately covered by health insurance. Affordability further complicates the picture. 29% of American adults do not take their prescribed medications as directed due to cost concerns, choosing to eat or pay a light bill instead of taking necessary medication. DiRx addresses the need that states 90% of prescriptions dispensed in the U.S. are generics. This translates into 65% prescription spend is spent on generics. DiRx also provides a unique annual savings plan not seen in the industry. They offer 2 annual savings formularies. In the first ASP, they provide 500 scripts options for one annual fee of $119. Now, what this means is if a medication that you take appears on this list, it doesn't matter whether you take 1, 3, or 10 medications. If they appear on this list, you won't pay more than a total of $119 a year for all those prescriptions. Now, the second annual savings plan, noted here at $299, is basically the same, except it contains more expensive generic medications. Again, if your medications appear on this list, it doesn't matter whether you have one costly medication or multiple prescriptions. The annual savings plan has you covered. I encourage you to log on to DiRxHealth.com and review the annual savings plan lists to see if this would be a better value for you versus the single prescriptions at a time. Most of us are conditioned to use the age-old method to acquire our prescriptions. Drive to the local pharmacy. Some will never change, as old habits are hard to break. And unless it hits their pocketbook too hard, time and time again, most are just one added health condition away from disposing of the old way and transform to the new. While new is not always better for some, DiRx makes that transition easier by providing 24/7 access to place an order, whether it is using the convenient online services or by phone. Once your prescription is placed, it will be shipped to your door in discreet packaging, which contains the attractive marketing prescription package you see located here. Your prescription order is shipped, again, at no cost. And speaking of breaking old habits, DiRx knows it may take a little prodding or pushing to have you try a new solution, even if that solution provides a tremendous savings on the most needed prescription meds dispensed today. So DiRx will provide up to $100 off your first month's prescription spend just to give them a try. You'll have access to 1,400 plus low-cost generic medications for you or your dependents, and they'll be shipped to your door at no cost. DiRx is really making being stubborn pretty hard. DiRx provides even more attractive employer-based prescriptions plan. While DiRxHealth.com is the publicly viewable site showing incredible cost savings, there's also a member site built with additional savings for employees of businesses that provide a spreadsheet-based employee census. Because 90% of all prescriptions are generic and 100% cost too much, DiRx takes advantage of the economies of scale that group enrollments provide, and they pass additional savings on to the employee patient. Now, updated census submissions are easy, as it is never necessary to remove a former employee. DiRx operates with once enrolled, they're always enrolled. So if a person moves on, they're still included under the DiRx plan. To review, why DiRx? There is no insurance required to fill your prescription. So anyone, whether they are on the company's health plan or not, has access to the best pricing available. DiRx sourced medications eliminate the umpteen middlemen that drive prescription medications to the level of those retail pharmacies. If you haven't heard me say free shipping on about 4 or 5 occasions during this webinar, I'll emphasize it again. You can spend $4 gas and your time visiting your local pharmacy and spend more dollars on the overpriced items you happen to pick up along the way on your visit. For groups of over 100 employees, there will be a small monthly administrative fee, but very small. What's the next steps? Well, to get started, download the employer census spreadsheet and simply include all full-time and part-time employees, whether they're on a health plan or not. DiRx will send a welcome email, and that outlines for the employees the steps to set up their personal profile. They'll enter into the secure portal their current prescriptions with the dosage and frequency. DiRx will ask the patient if they want to communicate with their own physician or their own pharmacy currently to initiate the transfer, or the patient can ask DiRx to do that for them. I had DiRx take the lead to transfer mine, and they did so without a hitch. Now, as we transition from DiRx to our other partner, if you as an employer or employee representative operate a self-funded health plan, then the remainder of this webinar will provide you an overview of a partner that can, in certain circumstances, help save up to 40% of your overall pharmaceutical spend on specialty medications. Of course, the DiRx benefit is vital to drive savings on generic medications, but in conjunction with PriceMDs, these savings will be even greater. Employers can have a major impact on the tremendous cost specialty meds, name brand meds, have on self-funded plans. Name brand specialty medications can range from $3,500 a month to over $100,000 a month. Just a single person could attribute to over 40 or to 50% of the annual prescription spend. That's how we impact that result with PriceMDs. PriceMDs is a direct importer of a limited number of very high cost medications, which essentially touch 1% of the population. And by delivering high value in return, PriceMD makes a major difference. These medications are from Tier 1 Western European countries and Canada too. and are the exact same medications, the exact same, from the exact same manufacturers, the exact same, that are dispensed in the U.S. today. Utilizing PriceMDs, a typical savings ranges from 25 to 35%, but could be much more for rare medications. PriceMD has no startup, monthly, annual, or termination cost. PriceMDs can be added off-cycle as a bolt-on solution along the PBM or the PBA. There is no disruption to existing relationships. It is simply an alternative source for a small number of very high-cost drugs that have a very large impact on your self-funded plan. 100% of PriceMD's customers renew the program each year. The program is free to use except for the cost of the medication. There are no fees to use PriceMDs. That is, no setup, PEPM, file, or cancellation fees. As you can see here, there are prominent organizations that renew service each year. This is the customary journey delivered via a white glove concierge style service with PriceMDs. Members receive a welcome package at their home, introducing their personal nurse that's assigned to them for the life of their case. The nurse navigator contacts the patient and secures a HIPAA release and conducts an initial review of the member's file. The member will have about a 20-minute call with a PriceMD staff physician located offshore. They review the member case and duplicate the script in order to source it from a lower cost international provider. Next, the script is written. Meds are direct sourced for the same brand from the same manufacturer. They are then shipped. The member receives the meds, and then the assigned nurse navigator contacts the member to confirm delivery and answer any questions. Getting started with PriceMDs is fairly easy. They will provide a cost savings estimate based on your actual previous year's spend at your request, including strategies to realize savings right away. A simple services agreement and a business associate agreement are all that's needed. Typically, a PriceMD solution can be up and running to help cut expenses in just a few weeks. Here is a client, a school district in Pennsylvania, that saves approximately $130,000 with about 7 of their employees that require a specialty medication. It appears 2 people shared the same type of medication. Overall, simply shifting these meds to PriceMDs will save an estimated 26% over the previous acquisition method. You know, the transition away from traditional medication acquisition is ramping up. The results present significant savings opportunities for the principals in this process. Whether you are the employer of a fully insured plan where the DiRx Health solution will impact the overwhelming number of generic prescriptions bought with a savings on average of 40 to 50%. Or if your team handles a self-funded health insurance plan, the addition of PriceMD's partnership could reduce your overall plan spend by up to 40%. If you have questions, please feel free to post them in the chat, as I mentioned earlier, or you can send them to one of the email addresses that you see listed here. Thank you for attending. It was our honor to share this information with you, and we wish you good day.